Dr. Esha.
It's good to see you as well.
This is, I feel like, a good time to talk about our topic, especially as the season change, and so we are already
Yeah.
here in the Northwest getting rains and some
Yeah.
wind, so we're starting to feel the autumn coming in, right?
Definitely, definitely. I was telling Jacob earlier. I was telling him how the weather here is not yet broken. It's kind of back into the warm stages, but I'm really excited to go into the next season of fall.
Yes, absolutely.
Yeah.
And as usual, this class is really dedicated to better understanding the root causes of chronic conditions. Of course, we're going to go beyond what most practitioners are taught in medical or nursing or PA schools, and we're going to go beyond genetics. We're going to go beyond its old age, right?
Hmm.
And so what I really love about these classes that we're doing every Wednesday evening is that we are going to focus on, we're going to talk a lot about the mechanisms. We're going to talk a lot about epigenetics, which is really what's turning on or off those genes of disease. And we're going to talk a lot about what you can do as a practitioner to support your patients in their journey towards better health, right? So if you're here and you want to learn how to better identify the root causes, the factors that contribute to chronic diseases, and go beyond a prescription modality and have a variety of tools to offer your patients, you're in the right place. And today we got a special topic, Dr. Esha, right? We are going to talk
Yes.
about postpartum reset, which is how to help mothers to restore healthy weight.
Yes, I'm really excited about this topic. I feel like I say that about every topic, but I am excited because I feel this is not something that's commonly talked about, right? We have an entire world where everyone's talking about fertility and kind of getting pregnant and all that, maintaining, but you rarely see conversations around postpartum metabolic pictures, right? So this is really great that we're talking about this because a lot of mothers do struggle and they don't know what to do and they're looking for functional integrative tips that are breastfeeding safe and friendly and things of that nature. So I think this is going to really make a big impact.
Yes, absolutely. And we're going to talk about different concepts, right? When it comes to postpartum changes, right?
Hmm.
We know that obviously that is a complex topic, right? There's so much that is involved. And when a mother comes to see you as a practitioner, there might be several symptoms that are associated with that weight gain, right? Could be fatigue, could be sleep disruption, could be a nutrient depletion, or definitely changes in hormones, right? And we're going to talk about today how many of these factors are playing a significant role in that weight gain, in that persistent weight gain that many mothers just carry with them right after.
Hmm. Hmm.
It's just hard to lose that extra weight,
It's
right?
definitely a huge challenge, and I think the like postpartum patients I've seen, that's kind of one of the top of their list concerns is how do I, lose my baby weight? They'll say, right, or it's a year later and I still have this baby weight, and again, like we always talk about, a lot of these things are multifactorial, right? It's a lot of things adding up, so they shouldn't feel beat themselves up or feel too bad about it, but there are so many nuanced points that play a role in then like the postpartum weight picture because hormones are so different. It's not just a typical metabolic scenario. You've just given birth or created life. So things are definitely a different hormone soup than non postpartum weight
Yes.
picture.
Yes, and there are probably two major reasons why probably every practitioner should be aware of those. We're going to talk a little bit more about the implication of those imbalances. Let's call them imbalances, right, for now,
Mm-hmm.
or root causes as we refer to them in functional medicine. But we're going to talk about them and how it's important to address those, even if your clinic is not focusing purely on weight loss, right? Because they have an implication on how your patient feels and functions, right? And everything else and their health in general.
I'm not sure if it's just me, but Dr. Tall, I can't really hear you.
Oh, okay. Can you hear me now?
Yeah, it sounds a little muffled, but
Let me adjust my microphone.
That sounds better.
What about now? Is that better?
Yeah, that's better.
Okay, wonderful, wonderful. Yep. So what we're saying is that it's important for every healthcare practitioner to learn about those factors, how to identify and address them, because they can, even if they don't focus on weight loss, right?
Yeah, yeah,
So
totally, totally. Yeah, I think that like you were saying, there's so many factors to think about, and it's not only about, like you said, just the weight loss picture. And with pregnancy, weight is gained in different places, right? And so there's breast, there's uterus, there's baby, there's like amniotic fluid, there's blood supply volume goes up. So a lot of those things do recalibrate, if you will, but just having excess adipose tissue can create a whole other slew of like downstream metabolic issues that are just hard to navigate sometimes for postpartum women.
yes, absolutely. And one of our challenges, of course, even if you are as a practitioner, nurse practitioner, or physician, right, offering weight loss solutions. So a lot of our community members are actually starting today
Yeah.
their first class, their class in functional weight loss certification, right, which is 2 months, too much classes when they dive into the root causes. A lot of them come to see us, and this is an especially sensitive topic because, right, because so many of those clinics,
Yeah.
the magic bullet is, GLP-1
Right, right.
agonist medication, which you cannot use when
Hmm.
a newly mother
That's
breastfeeding,
right. That's
right?
right.
So this is again one of those, and we're going to talk some about more natural, more safer alternatives that do not risk the newly born baby, right?
That's
With
right.
in the same way that a drug would.
Right.
So Dr. Esha, take us a little bit about what is the current state of this. How big is this challenge, right?
Yeah, yeah. So when you look at some of the stats, most women retain about zero point 0.5 to it's like 4 kilograms, which ends up being like a pound to 8 pounds at 6 to 12 months postpartum. But 14 to 25%, which is a lot, may retain more than that, 4.5 kilograms or close to 10 pounds, especially if there's already excessive gestational weight gain. And up to, which is a really interesting stat I found, up to 75% of low income mothers in the US are heavier 1 year postpartum than before pregnancy. So that metabolic weight component does tend to play a huge role. And maybe there's some kind of correlative component to income and, access, things of that nature. And then outside of that, when a woman already has excessive body weight, obesity, if you will, they may retain less weight postpartum, but they're at a higher risk of long-term obesity if excessive gestational weight gain occurs. And then just beyond the aesthetic concern of many mothers, like increases in fat mass, like has actual health implications. Fat is a metabolically active tissue. It actually releases its own compounds and can impact our hormone and our physiology in its own way. So as we know, increase in fat mass, specifically around the belly, is associated with an increased risk of cardiometabolic diseases. And we think, but why is that? So let's test your knowledge and see if you guys picked up any context clues. So let's do a pop quiz. First pop quiz. Why is the belly fat, also called the visceral fat, why is it considered active? A, it's helping the body store vitamins. B, it produces extra muscle tissue. C, it releases chemicals that cause low-grade inflammation. Or D, it provides energy during stress. Everyone should get this one right. And the correct answer is going to be C. It releases chemicals that cause low-grade inflammation. So fat tissue is metabolically active tissue, and this is why one of the major reasons why it's associated with an increased risk of cardiometabolic conditions. And, as healthcare providers, we want to look beyond the diagnoses and to help our patients in the long term. We have to be focusing on prevention and wellness as well, especially since cardiometabolic disease or cardiovascular disease is the leading culprit for, death in Americans. And so if we know certain conditions can portend a worse outcome, metabolic issues postpartum, then we should be really working with our patients before they get pregnant, while they're pregnant, to really help support that picture. So yeah, I mean, I think it's really interesting, the topic of adipose tissue being metabolically active. And like I was mentioning earlier, Dr. Tall, a lot of the weight kind of picture tends to recalibrate postpartum, right? All the tissues that were larger, you tend to recalibrate, you lose a lot of that weight, but a lot of the adipose tissue can really hang on and lead to other cardiometabolic issues down the line.
Yes, absolutely. And that's something that, it's a big part of understanding that, first of all, as you mentioned, the adipose tissue is an active organ.
Right.
There's, interestingly, when we teach in the functional weight loss program, every week we kind of focus on the different contributors, or one specific contributor or root cause, right? And we always look at, when we look at hormones, right? We look at leptin, adiponectin,
Right.
and all of those different hormones. We talk about how the adipose tissue is an endocrine organ, right?
That's right.
And then when we look at inflammation and inflammatory pathways and how they contribute to weight gain and vice versa, we talk about the adipose tissue as an immune organ, right? So
Yeah.
it's really interesting. If you take one thing from our conversation today, and it's really that, to understand that the adipose tissue is not just a passive tissue just sits there, right? It's very much metabolically active and is impacted by everything by many of our hormones, right?
I really think that we have to, in a few years, we're going to have to redo all of the textbooks, right? Because when you think about endocrine organs, you don't see adipose tissue usually in classical textbooks, right? So we're not even trained to think that way. But adipose tissue, like you said, it's its own organ. Even like muscle tissue we talked about last podcast, it actually has endocrine activity. So I'm really happy that you mentioned that. I think it's really important for providers to remember and know that adipose tissue is an actual organ, endocrine tissue that's secreting into the body and influencing the system. But yeah.
Yeah. And that's important, right? I mean, we all go through anatomy and physiology and
Right.
all these different classes, but it's important, especially if you are in the weight loss field. And it is important, especially also if you're working with cardiometabolic patients.
Yeah.
Because, if you're not addressing that part of their body, it's going to be very counterproductive for those patients.
That's right.
So that kind of talking into hormones really drive us into one of the major factors that we want to talk about today, which is the hormonal or endocrine disruption. Right. So this is a big topic. Obviously, there's so much that we can cover with this. Right. We're going to start by mentioning that you obviously always want to mention insulin, right? Measure insulin because insulin sensitivity, right, shifts. Right. We know that pregnancy alters insulin signaling. And that, right. Postpartum, some women retain insulin resistance, which promotes abdominal fat storage. This is according to a study published by the Journal of Diabetes Care in 2014. So that's one factor, right? And the second factor is cortisol and HPA axis. And we previously talked about this, Dr. Esha, right? This is another one of those concepts that are just completely ignored in the primary care setting.
100%. Cortisol it's wonderful when it's doing what it needs to do, but it can be really damaging outside of that. So I'm really, any chance we get to talk about cortisol, I think, as much as we can talk about it, the better. So yes.
Yep. So for any of you who are just tuning in for the first time to the concept of HPA axis, essentially it's the hypothalamic pituitary adrenal axis. It's really your central stress response system, right? So let's say when you go through stressful or emotional situation, maybe you're stuck in traffic, maybe you have a certain deadline. We would definitely consider pregnancy and birth to be very stressful on the body, right? Both physically, emotionally, right? And so every time we're stressed, our hypothalamus signals the pituitary gland, which in turn signals down to our adrenal glands, which are sitting above our kidneys, and they release cortisol. And cortisol, there's multiple things that cortisol does, from increasing secretion of or increasing levels of glucose in our blood. So the physiological term is gluconeogenesis in the liver. It also mobilizes amino acids from the muscle and promote lipolysis. Therefore, it's really many of the what cortisol is doing is ensuring a steady supply for our body of glucose and fatty acids, right? So this is really important because if you're under stress, let's say you're under sympathetic activation, you're a fight or flight, right? You want to have lots of fatty acids and glucose available for your brain to be able to function, right? And so that's really important. It's also important for in the process of recovery, right? So when you have prolonged stress, this is where we can get in trouble. This is where we have prolonged stress, ongoing stress, or stress that is uncontrolled, right? It could disrupt metabolic homeostasis. And essentially what happens is it could modify your appetite. It is associated with accumulation of visceral fat, impaired weight regulation, and makes stress management a lot harder, right? And there's multiple studies that showed that the psychosocial stress around newborn care or birth, even sleep deprivation, right, can significantly elevate the level of hormone cortisol, which also increases abdominal fat. And it also will contribute to insulin resistance, because imagine your body constantly triggering, constantly producing more glucose. That could be even during the day or nighttime, and then insulin is secreted constantly, right? At some point, you're going to create a process in which, with inflammation, of course, it's a recipe for insulin resistance, right? So let's take a quick look at illustration from 2023. This picture was published in the journal Nature Reviews Neuroscience. And what we're essentially seeing here is the hormone level fluctuations preconception to postpartum. So it's really interesting looking at what happens in our body as our patient is going through these different phases. And you can see that there's throughout the pregnancy, right, from about preconception or conception, there are significant increase in the level of multiple hormones, right? So you got prolactin is increasing, and then in yellow you can see cortisol starting to spike up. Pretty much about month 2 to 4, cortisol starts to increase, and then month 7 to about a month or two postpartum, cortisol is at very high levels, right? Now, for some mothers who might have not adjusted appropriately, or maybe they need additional support, cortisol might be secreted ongoing because of that ongoing stress of taking care of a baby for the first few months, not sleeping at nighttime. It puts a lot of stress on our body, right? Now, what happens when cortisol increases? Our sugar levels increase as well, right? And if you have chronically elevated levels of sugar, you're going to start accumulating in the fat tissue. So this is just a really interesting view, right? And of course, in the functional weight loss certification training, we dive even deeper in how do we help to regulate these hormones. The progesterone and estrogen are involved in this. How does adiponectin and leptin are involved in weight gain? And so all of those are really, really important to be aware of. So, Dr. Esha, I know that there's It's a big topic, but it was really important to mention the role of cortisol, because it's something that is just overlooked by so many practitioners, even practitioners who are specialized in weight loss.
Yeah, I find so many practitioner or patients that I see who tell me their doctor doesn't, they just kind of dismiss the cortisol story, right? And they're never getting any testing to evaluate or anything to look at adrenal function or adrenal health, cortisol pictures, or even just taking a history in a way that allows you to gain that insight into how cortisol may be dysregulated by basic patterns they're describing, especially with postpartum, hair loss sometimes and postpartum is associated with cortisol issues, right? Because cortisol can turn off your hair's growth cycle. So there's so many things that cortisol can do that you can get an insight into with your patients just by taking a good history or doing some labs on them. But if we know somebody has a lot of stress outside of just giving birth, and they have life stress, work stress, all these other factors, you can probably bet money that their cortisol picture is going to be dysregulated. So I want to talk a little bit more about cortisol and kind of the adipose picture. So let's take a look at another image from a 2024 journal, the Journal of the Brazilian Medical Association. And this is kind of giving us a look at the pathways, right? So hypothalamus in the brain, that's the H. You have the P axis, so hypothalamus, pituitary, adrenal. All right, so you see hypothalamus releases a hormone that stimulates ACTH, which is basically a precursor that stimulates your cortisol release from your adrenals, which, adrenals sit on top of the kidney. So it's going from brain to other organs, releasing cortisol, and cortisol has all these impacts around the body, which you see the arrows. When we're under chronic stress, that main stress system gets out of balance. And so one of the results of this is more storage of that visceral fat. So you'll see these arrows increase lipolysis, cell proliferation, increase leptin, reduce adiponectin. These are cytokine hormones that relate to metabolism. And when those are dysregulated, leads to more visceral, that stubborn abdominal fat. That also, like you mentioned, adipose tissue is metabolically active, will kind of fuel metabolic issues. So like we mentioned, fat tissue can release its own chemicals, and it can keep the body in a state of low grade inflammation. And this ongoing inflammation keeps the stress system on, right? So it kind of gets into this really vicious cycle where when you have stress, chronic stress, poorly managed stress, that can lead to abdominal fat, belly fat, and then having belly fat produces its own chemicals that it kind of continues to fuel the stress response, right? So I typically describe it to patients as like a hormone soup, because sometimes going through all the hormones, it's really confusing. I'll just tell them, like, when this happens, it creates this hormone soup that leads to X, Y, and Z. So over time, just having this hormone soup, if you will, sets the stage for bigger health concerns, right? So we think about the metabolic issues, we think about high blood pressure, we think about blood sugar issues, cholesterol, dyslipidemia, even like fatty liver disease, which is like a whole new burgeoning of chronic liver. Well, it's not new, burgeoning of chronic liver diseases that's now kind of in the metabolic picture. And then research shows that abdominal obesity is strongly linked with stress-related challenges. So major life stressors, emotional struggles, difficulties coping with long-term stress. And I don't think people realize, like, the amount of stress that some of us go through is just not normal stress for human beings. And I think our bodies just don't know how to cope with it. And so you see kind of these metabolic dysfunctions as it's trying to cope with it. So I'm always recommending patients, find tools that are stress relief, stress management. That looks like having mental health therapist, counselor, whatever that looks like, to really help turn down the volume on that stress picture and help your system cope with it better. It's always a good idea. And then in many cases, people who have trouble managing stress show signs of an overactive HPA axis, especially when the weight gain is centered around the belly. So as you'll see in the image, like we said, your brain kind of can get some feedback and let us know, hey, this person's stressed. You have more cortisol being released. Cortisol can do all these things in the system. Blood sugar regulation, impact your fat metabolism, lead to more visceral obesity, metabolic syndrome. That kind of stimulates the pathway. So it's all a really big circular picture in the system. So let's I'll stop talking. Let's test your knowledge. We're doing the pop quiz on the HPA axis and cortisol. So which of the following is true about cortisol? A, it's going to decrease blood glucose by enhancing insulin activity. B, it increases glucose levels by stimulating gluconeogenesis in the liver. C, it has no role in metabolism and only affects mood. D, it lowers appetite and prevents fat storage. And then E, chronic secretion of cortisol reduces inflammation. So let's take a few seconds. The correct answer is going to be B. It's increasing glucose by stimulating gluconeogenesis in the liver, and that's going to contribute to weight gain. And so, like we mentioned earlier, cortisol is anti-inflammatory in the short term, but chronic secretion can lead to glucocorticoid resistance and increased inflammation rather than reduced inflammation. And so, Dr. Tom, I'm curious, when it comes to stress management, I feel like that's one of the most challenging things for patients to master. It's not a supplement, right? Sometimes it can be a supplement, but a lot of times it has to do with lifestyle modifications. I like to recommend, hypnotherapy, mind body medicine. What are your go-tos for like mental stress management?
Yeah, absolutely. I think that anything we can do in lifestyle wise is always the best.
Yeah.
Because it's not just about giving the patient a certain prescription or recommendation of a supplement or something like that. We're trying to create healthier habits that would lead to a healthier person, right? So that's essentially our end goal. Now, yeah, we have so many, we constantly hear from physicians, especially who are trained in, the core of the practice, and all the tools they have are pharmaceuticals, right?
Right.
So with many of them, we hear that, they've never thought about the root cause because their model was purely focused on, here's a diagnosis, matching that to a drug, here's the prescription, go home, right?
Right.
And the problem with that is that it puts our patients in a very passive place where they're not told to do anything about their health, right? And so as a result of that, we know that health doesn't come from taking a prescription. Health encouragement, it comes from healthy habits, right? Improvement in health is really what our end goal is. And even if, you are, we all go to healthcare to help people get better, and the goal is really, we always used to tell our patients, and our patients would pay out of pocket. We used insurance at some point in time, but then we transitioned because we wanted to focus on what the patient needs rather than what somebody else will approve for them or not approve. And so as we transitioned, right, we started noticing that we stopped looking at what the insurance would cover and what they won't cover, and it was purely focusing. The conversation was 100% with the patient, right? There was no third party involved in it in their care anymore, which was amazing because it allows you to utilize all the tools that you have, right? And this is where lifestyle, as you mentioned, is a very important part. And I'll add something to this. Although we are focusing right now in this class on postpartum weight gain, right? And what's the mechanism and how to resolve that. It's really important to mention that a mechanism such as the HPA axis or cortisol, if that's imbalanced, right, it can contribute to so many different symptoms and conditions within your patients. Just to give as an example, there was one study published in the journal Diabetes Care that showed a few years ago a strong association between patients that have secretion of cortisol at nighttime and the development of type 2 diabetes. Right? There's other studies that show a strong association between elevated cortisol or imbalanced cortisol and anxiety, right? So if we do not address the root cause, what will happen is the patient will either come back and complain about the same symptoms, or you'll start handing over prescriptions over time, more and more prescriptions for other symptoms, right? It's kind of like having a leaky roof and you're
Right.
just running around with a bucket, right? You're running over there, you're running over there to catch all the drops in the house, right? So we want to do more of a corrective care. That's where we talk about this unique approach. And of course, since many of those mothers are breastfeeding, we would typically be very cautious. So they can't do GLP-1 drugs.
Right.
So if they come to see you and they're like, I'm trying to lose weight, I want to look better, I want to feel better, I want to have more energy, I want to get back to myself, right? And so we can't do so many of those medications. So we'll look at lifestyle factors. And then there are nutritional compounds that we can look into, right? We're typically gonna stay away from so many of the herbs, the amazing herbs that we would use for their therapeutical potency. But here we want to focus more on natural nutritional
Hmm.
compounds, right? And so one of those nutritional compounds is something that is called phosphatidylserine, and we'll post here the name just to make sure that yes, there it is. So phosphatidylserine is really interesting. It's a naturally occurring phospholipid that is found in especially high concentrations in cellular membrane of our brain and nerve tissues. So, and I think that is the incorrect study. We're going to get to that postpartum thyroiditis in a minute. But this is really interesting because there are several studies that reported that phosphatidylserine supplementation was showing to normalize both cortisol response and adrenocorticotropic hormone release. And so when they in one particular study, they had individuals with high chronic stress, right? And they had a placebo versus a treatment group. And they found that in response to social stress test, the individuals who were on phosphatidylserine supplementation had more normalized response, right? So instead of secreting more cortisol, they had secretion of lower secretion of cortisol, which is more balanced, right? And so, and you definitely don't want high cortisol in the evening because then it's hard to sleep and your brain is kind of feeling wired. And so, what is the dosage that we typically look into? Most studies recommend between 400 to 800 milligrams daily. Some studies were as short as 10 days. Some studies were as long as 42 days. Our recommendation is to consider, this is for general consideration, consider 30 days at a minimum of 400. If they can, 600, even better. So here's a product that we looked at. We've used it, Protocols for Life Balance. This is a professional grade supplement. So we know that there's third-party testing to make sure that there's what you see on the label is what you get in the capsule. And then this is a extra strength, which means that it's 300 milligrams. So essentially, we'd recommend a patient to start with the first week, they might start with one soft gel at nighttime, right? In the evening, let's say 8 to 10 p.m. And then from the second week, increase it to even 2 soft gels every night, and to help their body to modulate the secretion of cortisol. So that's one recommendation. And then let's bring up the other study about thyroiditis, postpartum thyroiditis, and switch to that one. And what we wanted to mention also as we transition out of this topic of HPA access is thyroid changes. This is also something to address. Postpartum thyroiditis affects 5 to 10% of women. So close to 1 out of 10 women could have temporarily imbalance of these hormones that impact hypothyroidism, which slows down metabolism, makes it harder for them to lose the extra weight. Now, we do have also specific protocols, nutritional protocols that could be used. We teach more of that in the functional medicine, the advanced functional medicine program. So if you're interested in learning more about these, more about the HPA axis, how to test for it, how to do a comprehensive analysis of thyroid that goes beyond TSH and T3, T4, what type of protocols you should use specifically, then you should log into the functional medicine, the advanced functional medicine and nutritional medicine certification training, where you would see more, you can learn more about those specific. We have specific protocols for all of those. So that's where we kind of conclude the hormonal imbalance. And of course, we also have to address other factors that can contribute to weight gain, right? And this is where, Dr. Esha, I know that you have a lot of experience. You have years of experience working with patients. And so what would be another important factor that practitioners should address?
Yes. I'd say another really big one, sleep, which is kind of like it's ironic, right? Because most postpartum, you're not really getting a lot of sleep. I mean, I hear women saying 2 hours, 3 hours max, right, in the beginning. And so it's really challenging because, like you were mentioning, sleep and that cortisol picture go hand in hand. So you're trying to kind of, calibrate the cortisol response postpartum, but then you're also not getting enough sleep, which further fuels it. So sleep disruption and energy metabolism go hand in hand, right? And so let's talk about a few studies as it relates to this and postpartum picture weight specific. So when it comes to sleep, when you look at some of the literature, poor sleep actually increases the risk of postpartum weight metabolic issues. In a study of 109 postpartum women, those with poor sleep quality and excessive gestational weight gain had 5 times higher odds of retaining more than 10 pounds postpartum. And at the beginning, we talked about kind of the normal postpartum weight retention is around, I think it was 0.5 to 2 kilograms. So 1 to 4 pounds is typically what you see, but 5 times higher odds of having more than 10 pounds postpartum weight gain with poor sleep quality. I know a lot of patients who have poor sleep quality just in general, and there's no baby involved. Then you add, maybe previous sleep habits or issues that weren't necessarily the best on top of that with the baby. So it can really drive some of the metabolic issues. Another study, looked at sleep and then long-term weight retention. So shorter sleep duration. So you have sleep quality, right? And now you have sleep duration. At 6 months postpartum, having shorter sleep duration, so sleeping less, predicted higher weight retention at 1 year. So, and this is like a common thing when I ask patients about sleep. There's 2 questions: is, how many hours of sleep did you get per night? And then, they'll usually go into it themselves and they'll say, oh, I sleep, 8 hours, but I wake up 3 times. I'm like, okay, well, you're not sleeping 8 hours, right? Or they'll say, I'm a really light sleeper and I'm always waking up, or I can't really get a deep sleep. I don't really feel rested when I wake up. I still feel like I can go back to sleep when I wake up. So, you can sleep a long time, have poor quality sleep. And then also just having shorter sleep timelines can impact your weight picture. So we have to have to talk about our patients and consider options, not only help them sleep longer. And, in the beginning of postpartum, it just is what it is. When you're, caring for a new life, you're just going to have that period there because babies don't sleep 8 hours, right? And so we have to talk to our patients about how to improve their sleep quality, and there are things they can do that are breastfeeding safe. And then also, when they're able, how to increase that sleep duration, not just obviously for better quality of life, but you're also helping them with their metabolic health just by focusing on improving that sleep picture. When you look at some of the mechanisms for this, sleep loss, so not having enough sleep can raise ghrelin. That's that like hunger hormone, tells us we're hungry. Can lower leptin, that tells us we're full, stop eating. So you're eating more, you don't have the signals to tell you to stop. So there you go, there's more weight gain. It can impair glucose regulation, which obviously glucose regulation and insulin go hand in hand. And insulin in and of itself can fuel other cardiometabolic issues down the line. And then also sleep, in so many studies, have been tied to kind of increased chronic inflammation. And so I would say I wouldn't say it's like the top thing, but I would say if you had to pick 3 things to support a postpartum mom on, I would definitely say sleep should be at least in the top 3, helping them to support deeper quality sleep. And then when they're able to, once the baby has a certain schedule or routine, they can support longer sleep durations. And so something I really like is a product that we'll put up on the screen. This one's called it's Sleep and Relaxation Support. It's by the brand Needed. And Needed is a really cool company. They specifically focus on nutraceuticals or supplements that support women throughout the reproductive journey, prenatal, perinatal, and beyond. And so this is their sleep relaxation support formula. Has magnesium, which is really great to help support relaxation. Has chamomile flower extract, which is also a really nice botanical to help support deeper sleep quality. Has the L-theanine, which L-theanine is going to potentiate or promote GABA. And GABA in the brain is kind of the neuroinhibitory brain chemical. So I tell people it kind of like it turns the brain down, kind of winds you down. And so that's good. And then it has L-glycine, which is also a really relaxing amino acid. So this is a really nice formula, and it's a powder. So, you can recommend this for your postpartum moms, to just have a little bit before bed, because that's where you're trying to get the effect is, sleep. So I wouldn't take it middle of the day or in the morning. So more so before bedtime to really help with that sleep picture. And again, the top 3 things, one of my top 3, not sure Dr. Tall would agree, but I think he would be sleep quality and improving sleep quality postpartum. So let's do a pop quiz to see what we've learned. So in the studies that I mentioned, what did a shorter sleep duration at 6 months postpartum actually predict? A, it predicted lower risk of weight retention. B, no relationship with weight at 1 year. C, it only affected mood, not weight. Or D, it predicted higher weight retention at 1 year. So a few seconds. I know you're all going to get this one right. I just mentioned it. The correct answer is D, right? So shorter sleep duration at 6 months postpartum, high weight retention at 1 year. So obviously these studies are not really saying, 2 months or 3 months postpartum, because you're probably not sleeping or the patient's probably not sleeping. But 6 months postpartum, you do want to kind of start seeing some improvements to that sleep picture for mom, especially. And so if you're interested, of course, in learning more about testing, the functional approach to postpartum health, along with functional integrative ways to support your patient's metabolic health, you can log into your advanced and clinical functional medicine platform. You can also book a coaching call with us to review case studies and then help you offer functional medicine right away. Again, this is a part of your program. It does not cost you any extra. Hey, Dr. Tall, do you agree with me? Like top 3 things you would consider for a postpartum mom, one of them would be sleep?
Absolutely.
Okay.
Absolutely. I've seen that. This is something interesting that, we talk to so many practitioners who reach out to us. Our team probably makes hundreds of calls. I'm not kidding. Hundreds of calls every day. And it sounds like a lot, but we have a team, several team members just as admin advisors, taking calls, answering questions, and it's really interesting that with so many I just had a conversation with somebody yesterday who's is mostly focusing on pain management, right?
Mm-hmm.
And they were now trying to introduce integrative medicine, because they're saying a lot of our patients, they don't want more drugs or more shots, right? They're looking for, more alternatives. And then on the other side, there's more patients coming in, then they want to do more wellness now, right? More of like, how do I, get healthier, feel better, function better, have less joint pain, right? And we were talking about how much sleep is important and how much it's so important to understand how to improve and optimize your patient's
Mm-hmm.
and wellness, because sleep can impact inflammation,
Mm-hmm.
right? Lack of sleep can impact your hormones, right? And so we constantly repeat the same sort of mantra, right? If you just prescribe your patients and send them home, you are overlooking, right, 90% of these factors around the patient's lifestyle, diet, cellular function, gut health is a big one.
Right.
If you're overlooking and you're choosing not to look at all of those factors and all of those systems that play a role in your patient's health concerns, it's unfortunately with so many times, it's just setting ourselves and our patients for failure.
That's right.
And it's kind of a shame, because the opportunity to help patients are there. They see you as the trusted advisor, right, for their health concerns.
Mm-hmm. Yeah.
Beyond that, I had an interesting call. This happened just recently with another practitioner they own their own practice, and they were mentioning that with the different prescription, different things that they're doing, they're starting to feel concerned about their reputation because there are many patients that come in.
Mm-hmm.
A lot of them pay out of pocket for these therapies or drugs, and they don't get the results that they want. So some of them, he's afraid of bad reviews on
Right, right,
Yelp. And so my conversation was focused a lot on, one, your reputation is really important, because if you tarnish your reputation and people put bad reviews about you, it's going to be really hard to get out of that.
that's right.
And then it's going to impact you financially, right? So
Mm-hmm.
less patient comes to see you, it's definitely going to impact you financially. And then, of course, we talked about the integrative approach, right? Which is what we talk about here. Like, what other things can you add, right? Collaborate with a health coach to help them, right? If they need a psychologist, right? There's a lot of postpartum depression, anxiety, stress. Collaborating with other professionals, it can be a really
Right.
beneficial for some patients. Looking into their gut health, right? The gut microbiome shifts drastically throughout pregnancy and after birth. So, right?
And I would say gut microbiome is also a really safe and easy target postpartum. Yeah,
Absolutely. Absolutely. Right. While we cannot or prefer not to provide pharmaceutical solutions
right.
because that can go to the baby, right? Um,
Even simple things, right? Like more fiber in the diet can change the microbiome.
exactly.
Even more prebiotic, probiotic foods can super like small changes, just the consistency of them can make a huge impact to your metabolism just through your microbiome. So yeah.
Exactly. Exactly. And there, by the way, when you go through our program, there are very specific protocols, like very specific. We go down to like which strains or specific product you can find those strains, and which studies show us how to modulate the gut. Very, 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 this is what we call precision medicine, right? It's like
Mhm.
when you go down into really understanding each patient instead of just understanding the disease, right? Because if you see a patient that comes to you with postpartum depression or postpartum weight gain or whatever it is, right? Or arthritis, whatever it is, if you might have learned in medical school the diagnosis and then the prescription, right?
Mhm.
That's one thing, right? So you learn how to do medicine for conditions, right? But unfortunately, many practitioners in our program, they say, as they go through our program and they learn how to really evaluate the function of, each function of each system in their
Uh-huh.
patient's body and address it, they start to understand the concept of precision medicine, which is not a treatment for a disease, it's a individualized treatment for the imbalance that their patient is
That's right.
experiencing, right? So it's much more personalized.
That's
It's
right.
not the same pill for every ill. It's more of a, how can we have to customize some of those therapies for our patients. So we mentioned some of them today. If your patient struggles with extra cortisol, if they have the signs of extra cortisol, they have the anxiety, they have maybe ongoing circadian rhythm imbalances, even though their baby is like a few months old and they're
Mhm.
already now sleeping more during the night. Start identifying those symptoms and signs earlier to maybe order an adrenal profile test
Right,
or
right.
looking at some of their hormones, right? Looking at thyroid, looking at adrenal, HPA axis, looking at their gut, right?
Mhm.
And Dr. Esha also mentioned inflammation, right?
Yes, yes, that's a really big one. And, I just think, as long as you're alive in the world, you got some level of low level inflammation, just the world we live in. Then you add onto that, producing a human being, then you add onto that, having to care for literally from your body and nourish a human being. Like it just creates like a perfect storm. And I think that a lot of times, mothers are forgotten about in that metabolic inflammatory category, but it's something that you can get on top of. You can encourage your patients to just be mindful of with small changes to really turn down that inflammatory volume. And my favorite way to do that is by targeting the gut. It's super simple and it works, and the research is there for that. So I would say top three things would be sleep, gut, and then there's one other thing that I think, but I would say, as I'm thinking of it, gut health, sleep quality, maybe something else, Dr. Tall. I would be,
Endocrine.
yeah, endocrine be the
Yeah.
top three. I would think supporting the postpartum mom that are no brainers and that can really make a big difference in a short period of time.
Yeah, absolutely, absolutely. And this is, by the way, for all of you who are watching us and you're already in the advanced and clinical functional medicine program. We call it advanced and clinical because we get you into things right away. And we encourage all of you have access to do case studies with Dr. Esha, Dr. Chill, Dr. Kim, our team of very experienced practitioners. Dr. Esha has been a functional medicine physician for years, have a lot of experience. Same thing with
Decade now.
for over a decade. Yeah, decade. That's amazing. That's amazing. Using a lot of the functional medicine labs. So it's one thing to learn about functional medicine through classes and reading about it, but it's a whole different thing to go and actually do case studies. Bring somebody from your practice who's been struggling, have them fill out our evaluation tool, which will kind of funnel all the symptoms and signs into like what are the top 2 or 3 imbalances you want to work on. That's why we developed that tool. It's for you. You can use it as many patients as you want. And then work with our mentors to show you from the first month in the program, how do you apply the functional and integrative approach to help your patients.
Right.
And then we can also help you, of course. We have practice building systems and classes, and Dr. Chill is really good with mentoring. We mentored many nurses, nurse practitioners, physicians, PAs, pharmacists to build their own practice, and they're doing very, very well for themselves. So we're here for you. Don't wander out by yourself. I've done years of trial and error, and it just cost me so much time, so much energy, so much frustration.
Yeah.
And I should have hired a mentor a long, long time ago. I would have saved a lot of suffering and probably make a lot more money, to be honest with you. I'll be a lot more successful earlier in my career. So this is why we're here. And we want to show again the picture of the advanced program, which includes it's 24 hours access. It's clinically focused. We teach you the whole system in like the first few months. And then there are advanced classes on women's health. We talked about women's health today. There's specific protocols for men's health, geriatric, hormone imbalance, autoimmune conditions, cardiometabolic, chronic pain, neurological conditions. Pretty much, it really prepares you for everything that you're seeing in your practice. And of course, the coaching is there. It's there for you. It's included, the mentorship. So use it. That's something that's included in your program. So I wanted to thank Dr. Esha for taking the time to share with her years of experience, a decade of clinical experience with functional and integrative medicine.
Totally. Thank you for having me.
And I also want to thank our team of media professionals and Jacob for helping us to bring us all together to you. And of course, I want to thank each one of you for being here, really taking the time, energy, effort, putting some effort into it to bring more solutions to your patients, right? You are the guiding light in your community, or probably beyond for some of you, for those patients. A lot of those patients are just going to keep wandering from one practitioner to the other. They're going to spend a lot of time and effort and money trying to figure out solutions. So we want to help you become their health expert, right? So you can offer solutions, help them improve their health, feel better, look better. That's really what we're here for. We're here for you. So thank you again for everything you're doing for your patients, your community. And I hope you all take care of yourself for now. And I think we might still have open registration for the functional weight loss certification program, since we are literally starting today, the first class. So if you're interested, reach out to our team. We'll provide some additional information. And I hope you take care in the meantime and have a good evening.